What inspired you to bring acupuncture into the Institute?
Again, it's just that I see that these patients are on they go through so many avenues to get help. And then they come here and they're taking a list of medications and they take a handful of supplements. Supplements are not bad. The idea is offering them something that they can do that doesn't involve a side effect or an interaction with another medication that they're on. And it will get better. It's hard to say when they're taking 10, 12 drugs, what is it really that's making an effect?
And today, back by popular demand, I got Dr. Jackie Junco to come back in and talk to us about a subject we touched base on in one of our previous podcasts, but the feedback was really clear that people need more information about what you do, Dr. Junco, and specifically about acupuncture. And so thank you so much for coming on the show today. I really appreciate it. And good to see you, and thank you. And I'm excited to talk about this.
Thank you, Lily. It's good to be back.
It is. It's always fun when we have time together. I love to come into your clinic and get my little beads in my ears, my auricular points that you always tell me about for stress. I love it. It helps me so much. And so I want to jump in. I know you do so many different integrative modalities in our institute and in the clinic, but I want to talk specifically about acupuncture. Can you give me a little bit of the basics of acupuncture? A lot of people out there think that it's just popping needles randomly kind of in the body. So can you tell us what acupuncture is?
Okay, well, acupuncture is just the insertion, called puncture, to do puncture the skin. So it's the insertion of thin needles in different areas of the body, depending what needs to be addressed. And it's been around for thousands of years. And it can be used for anything. And when I mean anything, I mean anything from hair loss, to cosmetic, to pain, to hormone dysfunction, sleep. It's amazing what it does.
And it's crazy because I think a lot of times people think of it a lot for pain, right? It's such a critical part for our patient population that's dealing with chronic fatigue or viral reactivation or individuals that, can't sleep. And so I kind of grabbed some of those topics a little bit. And with acupuncture, are you putting them just randomly in the body, or are there strategic places that the needles are placed?
For acupuncture, there's about 360 acupoints.
Oh.
The Chinese came up with thousands of years ago. So, and it's interesting because those acupuncture points are in areas of the body that contain, now there's been studies done that they've been able to dissect cadavers and see that where those acupuncture needles are placed is actually neurovascular nodes there that contain a large amount of sensory fibers, blood vessels, lymphatics. So now we're able to see, what happens exactly when you insert a needle and, the systemic effects that it has.
So we call those are those meridians? Is that the right term, or are they acupuncture points, or what are they called where the needles go in?
The meridians are like a network. I would say it's like it's like Grand Central Station, and then you have the little trains that go through the different through that station itself, or the little subsets of that. So the acupuncture points are along different meridians in itself.
So you use
puncture point is to exert a different effect depending what part of the body is needled.
You used a term that I just want to go back to really quick. You said that those acupuncture points, they've now shown that there are particular nerve endings or vascular tissue. Explain that a little bit to me.
Well, now we learn a lot about the fascia. And then the fascia is just one big network of connective tissue from the top of your head to the bottom of your feet. And within the fascia, the connective tissue, there's nerve fibers. And when those nerve fibers are stimulated and stretched, it causes an effect within the body. Whether it's, it also stimulates the brain to release different endorphins and pepperins, which are good, substances to be released. There's so many hormones to be regulated.
And so I always think of like if, that nerve and that the muscle contraction, in the tissue, like if you get goosebumps and your hair sticks up on your arm, or if you touch something that's hot, you automatically pull it away, just the brain reaction that happens. And so in these acupuncture points, there's a vascular component and a nervous system component. And each one is correlated with a particular system or function in the body. Is that right?
Right.
So are there certain points? So a lot of our community, and as we've interviewed a bunch of people, the commonality seems to be stress and sleep are two big components that get dysregulated when a person's dealing with chronic fatigue, chronic illness, viral reactivation, COVID long haulers. How does acupuncture, because we use it it's so impactful clinically in our clinic, but how can I explain to people how acupuncture can affect sleep and stress?
Well, for sleep, I mean, well, let's start with stress, because I think
Okay.
stress is the foundation of everything. We all have stress, and stress is just the automatic part of the autonomic nervous system is upregulated. So you're in that sympathetic drive, meaning like, you're being chased by a tiger or a lion, and you're always, your heart rate goes up, everything goes up. So what acupuncture does, it activates the parasympathetic nervous system, which is the opposite. So that's when everything's in rest mode. Your heart rate slows down, your breathing slows down, you're able to digest foods. But it's good to relax.
So
That's one of the beauties of acupuncture. It's able to get you into the parasympathetic.
So when a person is under stress and the stress is gone, let's say a tiger's chasing them and it's gone. I understand like there's memory, there's cell memory, but do we see with our patients that sometimes the drive or the stress drive doesn't re-regulate itself naturally?
Oh yeah, they have, dysregulation of the autonomic nervous system. So this is going to help bring that back into normality. And, when patients always ask me, and I'm sure we're going to address that, how long is that going to happen off the first acupuncture treatment? Because it took a while to get there. I always explain it's like going to the gym. You go to the gym, you want to get healthy. You're not going to get muscles and build the endurance in one exercise, one day at the gym.
Right.
With them in order to get the benefit. But acupuncture is the same way. It works over time.
And when I'm going to stick on stress for a second, because it's interesting. I think sometimes so many patients go into their doctors and their doctors say, you need to stress less, or even you need to implement some stress reducing techniques like, keep your technology away from your bed, or, um, don't get up, take 30 minutes or 10 minutes to breathe or meditate. But what I've seen with a lot of individuals in this situation is they really can't re-regulate on their own. And that for me, kind of on that outside, that's where I see the acupuncture being so important because it happens for their body instead of them doing it for their body. It's like this. Yeah, explain that to me a little bit. So when I get people and they say my doc says I just need to be less stressed, and I just laugh. I go, did they give a solution? Or they feel judged by coming in and saying, I'm tired and wired. I feel that nervous system drive. I have anxiety. And that's one of the times when I just want to grab them and say, please go see Dr. Junco or get into acupuncture, because sometimes you can't just think your way out of re-regulating your stress hormones or your nervous system.
Right. And you're right when you said the stress hormones, which is one of the other things. We stay in that, the cortisol goes up. You're going to there's so many factors involved. It's not just, the adrenergic response and, the cortisol and everything. It's also, the brain telling us, I'm not, I'm stressed, I have anxiety, I can't sleep. So all these things do get better. And one of the things I'm very big on, is breathing exercises along with, when I'm needling patients in the clinic, I would say, when they have the needles out, so, start doing some nice deep breathing. It sort of like, augments the benefit of the acupuncture.
Absolutely. So with stress specifically, when a person comes in and they have acupuncture, when we're trying to re-regulate we in our clinic, we look a lot at the immune system and the central nervous system. When we're trying to re-regulate things, how often do you think when people are receiving it, I know it works for my body, but in general, in our patient population or people dealing with chronic illness, how many times a week should they come in?
Well, I would say rule of thumb is at least once or twice a week, at least till we get the things under control. For chronic conditions, it could take from 6 to 8 sessions, and then we could space it apart a little more. So between once or twice a week is the best option.
So for me, my goal, I had a personal goal to come off of my autoimmune medication. I shared with you, I was on prednisone and on an anti-rejection drug. My health goal for myself was to try to re-regulate my hormone system and my autonomic nervous system. So I was diligent about twice a week with acupuncture because I just couldn't think my way or even meditate my way out of it. And there was something about the acupuncture that it was kind of like I felt like my electrical system was short wired, and it was like acupuncture came in and put like all new cabling in for me. I don't know how else to explain it, but it was really the feedback loop. Why did I feel that way?
But, and another thing I mentioned, the effects are cumulative. So over time, the more
Yes.
you get, the better it's going to get. And it's going to last longer. Not only is it cumulative in the responses you're going to get, but it's going to last longer. So those periods that you feel less stressed, those periods that you're sleeping better, going to get better the more you get the treatment.
And I've always wondered, like, I feel better super fast. So when I bring acupuncture back into my wellness protocol, it's kind of like riding a bike. It's like my body goes, oh yeah, I remember this. Where in the beginning, I did it because I didn't really have a lot of other options. I had maxed out my medication. I felt like I had maxed out my exercise. I was, die hard into the nutrition piece. So it was like I felt like I did it regularly because I had to. And then all of a sudden it started making drastic changes in my immune system in my labs. And then now when I do it again, it's like a familiar friend. Like my body just responds. Is that cell memory or what's kind of happening?
The best, and that's what legally I recommend is once you've gotten to that point where you're feeling better, you don't need to come every week. Because I know some patients are like, oh, it's really unaffordable. It can be pricey if you need to come once or twice a week for months. But then you could just come once a month or once every 2 months and your body does a reset.
Hi, it's Haylie, your host. I know firsthand what it feels like to find real impactful solutions to your struggles. And I know what it feels like to lose hope. We are being bombarded by toxins every single day. As a matter of fact, the world's largest single environmental health risk is air pollution. One thing that is becoming crystal clear is that environmental toxic burdens in our bodies must be addressed. Let me help you tackle toxic burden. Go to HayliePomroy.com/detox and download my free Detox Decoded Masterclass. Let's give you a fighting chance. I know what it feels like to lose hope, whether you're dealing with fatigue, mast cell activation, an autoimmune disorder, long COVID, viral reactivation, anxiety or depression, or inflammation. All of it can feel overwhelming. I will teach you nutrition and natural therapies to help your body eliminate toxins. I cannot wait to see you there. Again, that's HayliePomroy.com/detox.
Let's go to hormones a little bit. So we've seen a lot of individuals with autonomic dysregulation, like in POTS, right? And then we've also seen a lot of people that have irregular periods or things that seem to have an expression in the body that have a hormone component. Why is acupuncture so profound with hormone re-regulation?
Unfortunately, the studies of why and how are not there yet, but we know it works because when I've seen patients over, my 20 years of doing this and, have benefited from, the painful periods, from infertility, low libido, weight gain, weight loss. I mean, weight gain is a big thing. People with obesity, which is hormonal based, they do great once you start acupuncture. The regular menses, it regulates the menstrual period. So it's not only, the people say, okay, weight gain, there's a lot of things you could do. Yes. But for regular menses or endometriosis, polycystic ovary syndrome, all those things are hormonal and it works. Now, how? We haven't done enough studies yet. In China, they have, but we here in the United States, we're a little bit behind on those studies.
So when so for me, I had really good resolution I used to have ovarian cysts all the time. And it was just, I'm going to say a bonus. I wasn't why I was set out to do acupuncture. But since then, I've seen so many people have, better periods, even fertility. We see a lot of improvement in the fertility space. Um, with, with in our clinic, when individuals are dealing with chronic inflammatory disorders, why are the sex hormones impacted? Are they correlated with inflammation at all?
Well, it's all coordinated with the brain. We have, the hypothalamus, for example, controls all the other hormones. So I think everything has to be in homeostasis. Everything has to be in a balance. If you have a dysregulation on one, it's going to affect everything else going on in your body. And that's what the problem is. For these patients have so many things going on. It's not just, the pain, not just, the lack of sleep, the hormone imbalance, the orthostatic hypotension, the myalgias. They just have so many things that we have to sort of address things little by little. And acupuncture is great because they can do all that in one treatment.
Wow. And is it because it supports that communication pathway?
Yes, and it's also, it's been proven to be anti-inflammatory, help improve the circulation. So it's a multi-targeted tool, I would say.
So it treats the body holistically. Not only does Chinese diagnostics look at the body as a whole unit and even a unit experiencing things outside of the unit, right? I always think that's like people will study the heart or they'll study, the liver and not even give a blink to the air we breathe or the water we're drinking or things like that. But acupuncture treats the whole body. And how do you know where to put the needles?
When a patient first comes in Chinese medicine, you learn how to, check their pulse. You go by their pulse and you go by sort of, I would say it's like you do a scan, you look at their tongue, you look at their eyes, you look at their emotions, and all those coordinate with different organs in Chinese medicine. So knowing when you have the organs that you're going to treat, you target the needles and those meridians of those organs effectively.
And if you're coming,
the patient it could either be, deficiency or an excess. So they could have an excess, so to say, of liver. And then you want to make sure that when you're needling that patient, you're stimulating the needle so the acupoint is working for an excess condition versus deficiency. And then you play with the time that you leave the needles. And I mean, it's a beautiful art.
It's fascinating. That's amazing. And I think sometimes we're so results driven at the Institute. Like we want our patients to feel better. And I think sometimes that's the motivation for us to integrate all these different modalities. But the acupuncture is really fast in its response. I mean, I know that it takes a lot of time in its rebalancing, but I've seen people that have acupuncture treatment that sleep better that night.
Yes, that's true. Now, does it last for the consecutive nights? I mean, it could for some. Depends on what's the underlying, sleep disorder or sleep problem. But in our patient population, you're right, but they take so many medications that the whole idea is, it's easier to do acupuncture with these. Doesn't have any side effects.
Right.
You're not adding on another medication. You're doing a modality which is going to improve everything else. And hopefully the goal is to get them off some of the medications eventually.
That's great. And it worked. That's what, like I said, it was when I was putting together a protocol for myself, it was really a cornerstone in getting my body back to balance because it was out of balance. And that's why I needed, crisis intervention medication. And it's not like it just automatically goes back into balance, or at least it didn't for me. It wasn't like one day I could just say, "Oh, I'm done with prednisone." I wish, it's not like a surgery when you're dealing with a complex illness. It's not like you fracture your tibia or your femur or you have surgery and you give it 6 weeks and you're done. There's a rebalancing as people come out of that particular disease state. I see that a lot. What inspired you to bring acupuncture into the Institute?
Again, it's just that I see that these patients are on they go through so many avenues to get help. And then they come here and they're taking a list of medications and they take a handful of supplements. Supplements are not bad. On the contrary, it's better than taking all these drugs. But the idea is, offering them something that they can do that doesn't involve a side effect or an interaction with another medication that they're on. And it will get better. It's hard to say when we're taking 10, 12 drugs, what is it really that's making an effect?
That's a very valid, because it seems like sometimes you go down that route, and if something doesn't work, another one's prescribed to see if that works. But sometimes we don't pull out the one that didn't work in the first place, or it has side effects, and then you need to take medications for the side effects.
It's very sad.
Yeah. Yeah. It's really hard to watch patients that are struggling with complex diseases, which means there's a complexity in the symptom profile, and doing anything and it not affording relief. I mean, that's the hardest thing for me to watch is to your point. What would you say when our patients come in, about how many different doctors do you think they've seen before they land in our clinic? I agree.
I mean, I'm like, at least 10.
Yeah.
Mm-hmm.
Yeah.
I think
Yeah.
more.
Yeah. That was the thing that really shocked me when I came into to our clinic, was listening to how many physicians that these patients of yours had seen prior to coming into the clinic. I was, and that's wonderful to have a Rolodex of practitioners on a team. Like, there's nothing wrong with that, except for there wasn't resolution. So it takes a village, right? It can take. That's why at our institute we have such a multidisciplinary approach, and we really encourage our community. So all these people that are listening out here, I'm a big advocate for you having a team to get you to wellness. And Dr. Junco, we have that under our home, under our umbrella. I guess people out there that are listening right now, what would you say to them if they don't feel like they have a team? What would you say as people have come into our clinic and they've seen 10 to 15 doctors before they ever get to us? Which would sound awesome if they were feeling amazing, right? Like, you think about a football player or a professional basketball player, and maybe they have 10 to 15 doctors, but they're at the prime of their physicality. We're getting patients that come in with 10 to 15 doctors and they feel awful, which is why they're flying in or driving in to see us. When you have people out there that are struggling right now, I think really important, the acupuncture and the Chinese medicine piece helps re-regulate the body and re-regulate it to the original insult, all the disease states that have compiled on top of it, all of the drug interactions, all of that. At some point, we need to start creating some sort of a homeostasis in the body. If people are feeling really out of control in their health and wellness, what are some things that they can do in their own world if they can't see an acupuncturist right now? Because you incorporate so many modalities.
Well, I think number one is being able to relax, and pacing, some meditating. Meditating is amazing because meditation also gets you into that parasympathetic setting. Certain exercises, breathing exercises are going to also activate your vagus nerve. Tai Chi, Qigong. I know those might be difficult for a lot of patients who can't really ambulate, but they're sitting, you can do sitting exercises, just getting that blood flowing, getting that blood moving, working on the inflammatory response by, activating the parasympathetic nervous system and being able to heal.
That's great.
Eating
That's
healthy
one.
is important.
Eating healthy is important. So let me review those for a second. So we talked about sleep and stress, and a lot of times in our Friday clinics, we focus on a lot of the complexity of maybe their neuroimmune labs, or maybe the complexity of their diagnosis that they received from somebody before they come in the door. But it all seems to go back to, if we can regulate their stress hormones and we can regulate their sleep hormones, that we have a fighting chance, right, to get their body back on a track to wellness. Would you say that those are kind of the two most important contributing factors to people getting well?
I definitely address sleep on everybody I see.
Yeah.
If you come in for a backache.
Right.
First, I'm going to ask you about your sleep, how you're sleeping, your sleep hygiene, what do you do? You, play on the phone before going to bed? Do you read on the phone? Do you wake up in the night? How many hours are you getting a good night's sleep?
And why is sleep so important? Why can't I not go on to, I mean, hey, I eat really well. I exercise, but I sleep 3 hours. Why can't I get away with that?
To be like that.
What happens while I'm sleeping that is restorative, regenerative, or anti-inflammatory? Like, why is it
Hormones that are secreted, we
cool?
have, we have growth hormone, which is secreted, which is good. We have a lot of a balance is going on at night. And we need that, we need the homeostasis to go on while we're sleeping.
I had a hormone doc that I was working with one time, and she said, sleep like a baby, wake like a baby. She said, if you don't care about anything else, it's anti-aging. I went, I gotta go to bed. But also, I think those stress hormones have such an impact, like you said, on the inflammatory hormones and insulin. So we have a lot of people that have been tuning in to this podcast, and for the first time, they feel like they're getting some hope that things can change for them. I think sometimes we see it a lot in our clinic, and so we have a really strong conviction about it. But for those people out there right now that are really struggling, can you give them some hope? Why do you feel so strongly that they can get better?
Well, the mindset is very important also. And I
Yes.
think we need to believe that there is hope, because there is. And I mean, if they don't live near us and they can't see us, there's a lot of other good practitioners out there. You just can't, I think that the main thing is never losing hope and always saying, looking at it's either you look at the glass half empty or half full.
Right.
You gotta start looking at the glass more full than ever. That's what
Right.
kind of there. And
Right. And I love, Dr. Junco, that you're doing a lot of, lectures and doing these podcasts, because I think people maybe don't feel like they have a resource. And by you being so generous with your time, it's going to, just that in itself is going to help people so much. So if I were sitting here today and I couldn't get into acupuncture, it either wasn't in my town, it was not financially an opportunity, although thank God we're seeing more and more insurances cover it, which is great. But insurance itself is that's a whole nother podcast. But how can a person help themselves on a daily basis? Give me 2 things that I could add into my daily routine that aren't going, I just think of when I was in the thick of things. It was like one more thing on my list always felt so overwhelming. But what are 2 simple things that I could do that you think will make a trajectory change in my in where I'm at?
I think again, the mind, I think the way you look at, you have to keep that hope going. And you do things on a daily basis. I think, working on your breathing exercises. And if you live somewhere that you can go outside, go out barefoot.
Ooh.
Get some grounding. Get some sunlight. You don't want to stay indoors because then, the whole depression and the psychological, it just gets worse. I'm a big advocate on going outside, walking barefoot.
And you know what? I'm so glad you mentioned those. I actually gave me chills because sometimes I get overwhelmed by the list of things that I'm supposed to do to take care of myself. And that just brought that like kind of childlike permission that you just gave us, permission to take our shoes off, go outside, walk on the ground, get a little sunshine. I just feel happier just like kind of visualizing that right now. That's so good. That's so good.
We have so many nutrients in the dirt and the grass and the sand, depending where you live. And even have grounding mats for those who live in buildings, that don't have the ability to go outside. All that is great. You want to create that balance inside your body that's unbalanced.
And our bodies are still struggling. When I'm going to say this differently, when we're struggling, our bodies are craving and seeking some kind of balance. I mean, especially when we have medications on board or have had surgeries, where we have scar tissue, our bodies are constantly craving that. And so something as simple as walking outside barefoot, the more you're struggling, the more you're going to respond to that. Because we just find the further along or the complex the patient is, the more that body is desperate for something to create a new homeostasis or a new balance. And if they can interact that way, it's free, it's pleasurable, and it really does make a huge impact. Right. And I love, God, I was trying to think, I was reading this the other day and they were talking about, the biggest thing when you're struggling is to try to get your grounding. You try to get grounded, try to be on sure footing, right? And look in your environment of where you can find sure footing. And maybe it's not there financially, or maybe it's not there relationship wise, but find something, get sure footing. So I just love that you suggested that. I think everybody's going to do better.
Everybody's going to go outside and work.
Yes, let's do it. I love it. Dr. Junco, promise me you'll come back and teach some breathing exercises. They are so powerful. And in the meantime, we're going to get a little sunshine. We're going to work on our mindset. We're going to get barefoot and get out on the ground. But I think the next step, I think I would really love everybody to have access to the power of your teaching with breathing exercises. Can I get you to do that for us? Right. You guys, my goal is that you have access to as much as we can possibly give you access to without even coming to our clinic. Our dream for creating this podcast was to give you hope that there is a better future for you and your health. We see it every day. We believe it. We believe in you. We believe in the power of your body. And also, we want to help you. We want to be that source and that resource for you to have these kind of gems and access to brilliant doctors like Dr. Junco that we get to be with in clinic every day, that I know you guys will only be healthier for knowing her. So Dr. Junco, I can't thank you enough for being here. I know I would like to just steal you away and keep you every day. I know you're busy, but thank you so much. I appreciate it. Breathing next, breathing. I'll go take my shoes off. We'll talk to you soon. Thank you, Dr. Junco.